Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, what are the unusual types? There are unusual types of pulmonary edema. So, in the pulmonary edema, we have the expansion pulmonary edema. Then we have high altitude pulmonary edema, re-expansion pulmonary edema, high altitude pulmonary edema, and we also have pulmonary edema which is resulting from pulmonary edema resulting from upper airway obstruction. Okay, first we will see re-expansion pulmonary edema. What is this re-expansion pulmonary edema? In re-expansion pulmonary edema, first this will develop. This re-expansion pulmonary edema develops after removal of the fluid or air after removal of air or fluid from the pleural space. First you have, if there is any pleural effusion or pneumothorax, then the air has been removed from the pleural space and from the pleural space. So the pulmonary edema will develop. This pulmonary edema will develop after the removal of the air or fluid from the pleural space. Okay, these patients will actually develop hypotension. They will develop hypotension or oliguria will be seen, and as a result this will result in rapid shift of fluid will occur into the lung. Because of hypotension and oliguria, the rapid shift of fluid occurs into the lungs. So here the main important thing, contraindications in re-expansion pulmonary edema are diuretics and preload reduction are contraindicated. Then intravascular volume repletion is needed, often needed. Intravascular volume repletion is often needed in these patients. And we should also support the oxygenation of the patient here, and also gas exchange should be supported. And we should give intravascular volume repletion, that is, it is occurring because of the removal of air and fluid. So if you actually give the air and fluid, volume repletion is done, obviously this expansion pulmonary edema will be subsided.
thank you and thank you for watching.